CLL is a short form. Abbreviation stands for chronic lymphocytic leukemia. The leukemia is a type of blood cancer, but it is not as worrisome as other types of leukemias. It is a slow growing disease and it is very rarely life threatening at the time of diagnosis. CLL is usually a disease of elderly. The average age of presentation is around 65 to 70, but we do see patients at the age of 45, 50 also, but that is very low down on the spectrum. And there is no particular factor where you can say that some habit forming or some genetic, there are no such factors. Anyone can suffer from CLL, especially elderly males or females. CLL is divided into 4 stages. There are 2 types of staging system. Staging is based on the clinical picture. When you have only abnormal increase in white cell count and lymphocytes in the blood, and there are no other symptoms. Where there is, you can feel some lymph nodes in the neck, underarms, and they gradually increase in size. When you have abnormal liver and spleen. When you have low hemoglobin, usually the cutoff is less than 10 gram per deciliter. Where you have low platelets, and usually in CLL when the disease progresses, it is stage wise. You will never have stage 2 directly, stage 3 directly. It will be stage 0. In spite of the name being leukemia, the name being blood cancer, stage 0, stage 1 and stage 2, which I have told, we can avoid treatment. You can just keep the patient on observation, and with proper counseling and informed decision, I have lot of patients for years they have been kept on observation and they are happy. We don't treat CLL if they are having no symptoms. We will treat CLL only when it is in stage 3, stage 4, that is reduction in hemoglobin and platelet count, or the patient is having persistent fever, persistent weight loss, repeated infections, or the lymphocytes are doubling within a period of 3 to 4 months. These are the indications when we treat patients of CLL. Otherwise, if there are just abnormal WBC count, or if it's just abnormal lymph nodes and there are no symptoms, we will just keep these patients on observation. The treatment is also very varied. It can be chemotherapy drugs, it can be oral tablets. Classical thing about CLL is that you can treat them with varied options and you can treat them in sequence one after the other, but only sad part is that we can control the disease. We cannot cure it, but yes, we can control the disease for years. It may be 2 years, 4 years, 5 years. The disease relapse, then you again treat another 2 years, 3 years. So it is a chronic disease like diabetes and also a very low grade cancer and can be treated very well for years. Now the chances of disease, if I have to give you a rough figure, can be 85-90% that the disease will relapse. But this relapse can happen at a gap of 2 years, 4 years, 6 years, even 8 years. So the relapse can happen anytime, but since these patients are not cured, they are treated, the disease can always come back. We cannot cure CLL, but we can treat, and CLL is a very low grade chronic disease like diabetes. We can treat it. If it comes back, then we again treat it. If it comes back, then it again treat it. And couple of the patients may not even require treatment also for years. So I think you have to have a lot of courage and you shall not be disheartened if you have been diagnosed with CLL. This is an indolent type of blood cancer. I will say low grade blood cancer.